People scramble to get their hands on GLP-1 drugs. The first of its kind study is examining reasons why patients discontinue or reinitiate obesity drug treatment. Research is finding that patients without type 2 diabetes are more likely to discontinue treatment, while other factors like income and drug side effects are also playing major roles. Lead study author Tricia Rodriguez joins us now. She's a senior applied research scientist at Truveta. Tricia, great to have you with us. This is a fascinating study, particularly as companies are looking at ways to, I guess, keep people taking these drugs. What was interesting to me was, I think that there was an assumption in the marketplace somewhat that if people saw a great weight loss, they were very successful on these drugs, that they might stop and try and just keep it off on their own. But that's not what you found. Those people are more likely to stay.
Thanks so much for having me. That's exactly right, Melissa. We found that weight loss was associated with a lower likelihood of discontinuation. So as patients lost more weight, they were less likely to stop the drug.
And in terms of, everything is a choice, right, in life. So also income has something to do with it, and the cost. What did you find?
Yes, so we found significant relationships with income, particularly for patients with type 2 diabetes. And this was really interesting because what we saw is that as income bracket increased, the likelihood of stopping progressively decreased. And then the flip side of the coin, of course, is cost. And on the cost side, we see that this much higher rate of discontinuation for patients that don't have type 2 diabetes, we know those patients face a much higher burden of cost because insurance is a lot more challenging for those patients. And so both from the income and the cost perspective, those seem to be playing a really important role in discontinuation.
And in terms of, just going back to the grade of the weight loss, it actually, you sort of sliced it into very fine tranches in terms of how much weight loss is associated with a likelihood of discontinuation, which I thought was really fascinating.
Yeah, so we looked at the sort of time-varying weight loss. And so each 1% weight loss was associated with about a 3% reduction in actually stopping the medication.
And what is sort of the takeaway of this study overall in terms of, if you're Eli Lilly or Novo Nordisk and you're taking a look at this data and you're thinking, how do I get patients to stay with the drug? What are some of the high-level findings that you have in terms of the patients who are more likely to stay on the drugs are patients who are what?
Right. It's a great question. So the patients who are more likely to stay on the drugs are, of course, patients that don't experience moderate to severe adverse events. They're also likelier to be experiencing a benefit. But I think the really critical piece here is that there is a gap in access. And so the highest income patients are able to stay on this drug, while lower income patients are less likely to stay on this drug. And so I think that's a really key takeaway of this finding, of this study, is sort of how can we enable greater access for a greater range of patients.